When patients are considering knee replacement surgery, one of the major concerns that they have is using the stairs, and their big fear is whether or not they are going to fall. And that's what we're going to cover in today's video. Hi, welcome back. I'm Adam Rosen, and if you haven't already, please subscribe and click the like button so it helps people like you find information like this. In today's video, I'm going to talk to you about one of the probably the most common concerns that patients have prior to knee replacement surgery, and that is using the stairs. Now, for some of you, you might live in a single floor dwelling, so stairs probably aren't an issue, but most people have stairs and they have to navigate stairs. And a lot of people are afraid of falling. And a fall is a real risk. Studies do show that about 3 million patients will visit the ER every year due to a fall. These are older patients based on Medicare data. About 1 million patients will be admitted every year for a fall-related injury, and about 319,000 of those are due to hip fractures. So a fall is a real risk. Now, as an orthopedic surgeon, I've taken care of lots of patients who have fallen over the years. The vast majority of them were not after surgery. These are patients that were living their normal day every lives and took a fall and a spill. So after surgery, one of the first things that I tell patients is that you're going to be extremely cautious with everything that you do, even getting off of the toilet. And when you go up and down the stairs, you're going to be extremely cautious. So the risk of falling, in my experience, has been very low. I can't even remember a patient that had a knee replacement that fell on the stairs and required some type of treatment or intervention. Now, it can happen. And there was this one particular study done not too long ago that found about 25% of patients have a fall within the first year. So this is not in the first day or week. This is in the first year after surgery, patients sustain a fall. And that's pretty common with CDC data that shows about 1 out of every 4 adult Americans will sustain a fall in the year. So the risk isn't really greater than patients that haven't had surgery. So I try to put my patients' minds at ease and say, yes, a fall is a risk, but you don't have this significantly higher risk of falling down the stairs just because you had knee replacement surgery. Now, the other important thing that I tell patients when they're concerned about using the stairs is that you should use the stairs, and you should not be afraid to use the stairs, because using the stairs is a part of the rehab. It's a part of physical therapy. It's a part of working on your range of motion and strength. And what I found over the years is that no matter what I tell patients, some patients don't always listen to the doctor. So you get patients that will say, I have a spare bedroom downstairs, I'm going to live downstairs. And I recommend that they live upstairs in their normal bed. Or I'm going to set up the sofa as my bed and I'm going to park myself on the sofa for the first few weeks, even though I recommend using the stairs and going up to their bedroom. Or they request or somehow get a hospital bed delivered to their house, and they basically live in this hospital bed for the first few weeks. Now, my experience has been that those patients actually have some of the slowest recoveries and less than optimal outcomes. Why? Because they forced themselves to be sedentary as opposed to being active. If we're doing a back fusion, we want bone A and bone B to fuse. So we say, lay on the sofa, take it easy, have rest. In a knee replacement, we don't want bone A and B to fuse. We don't want you to develop scar tissue. So we want you using it and moving it. And most patients aren't doing laps up and down the stairs multiple times a day. You might come down in the morning for breakfast, go up in the evening. Maybe one extra lap if you're going to do, take a nap in the middle of the day. But for most people, 1 or 2 steps up and down throughout the day is not a significant ordeal, and most patients can tolerate. Now, the other thing that I explain to patients is that you're not going to damage the knee replacement. So the thigh bone, shin bone parts and the kneecap parts are not going to be damaged by you using the stairs right after surgery. What is going to propel you up and down the stairs is your muscles, and what's going to stabilize that is the ligaments. Those are all the things that you had in your knee prior to surgery, and they're all still there after surgery. And if you use and activate those muscles, you're going to improve your strength, and you're also going to prevent some stiffness and scar tissue from building up because you're actively bending and straightening the knee. Now, most therapists will teach patients one of 2 things: a way of reminding you of how to go up and down the stairs. We usually would say, go up with the good and down with the bad, which makes sense to a lot of people. Lead with a good leg, and when you're coming down, go down with the bad leg. The other way people will talk to you about remembering that is the good ones go to heaven and the bad ones go to hell. So up with the good, good go to heaven, bad go to hell, down with the bad leg. And when you use the stairs, I always tell my patients, look, if you're having knee replacement surgery, before surgery, you're probably going up and down your stairs slowly. You're taking the steps one at a time. You're holding on to the railing. You're not looking at your cell phone. You're not carrying up a basket of laundry. So after surgery, guess what? It's the exact same thing. You're going to go up and down the stairs slowly. You're going to go up and down the stairs one step at a time. You're going to go up and down the stairs, usually holding on to a railing. Now, what the therapist will also teach you is if you don't have a railing, or most people have a railing on one side, they'll show you how to use a cane or how to fold the walker and use that in the other hand. So essentially you have two things to hold on to as you're going up and down the stairs. But as long as you use the stairs slowly, and you might have someone there the first few days kind of near you, just to make sure that you don't get lightheaded or dizzy. And that's another component, what we call orthostatic hypotension. So the big mistake would be sitting on the sofa, deciding to go upstairs, standing up, walking up the stairs, getting 3 or 4 steps up the stairs, and now you're lightheaded and dizzy. Now this can happen in the middle of the room. It's called orthostatic hypotension. And after surgery, you have pain medicine, you've lost some blood. You might have the chance to develop low blood pressure when you first get up out of a chair if you've been sitting for a while. So what I always teach my patients is sit, stand, then go, which means that if you're laying down or reclining, sit upright. Stay there for like 30 to 60 seconds. Then stand. Stay there for about 30 to 60 seconds, and then go. And this prevents the issue of sitting up quickly, stepping, and being in the middle of the room and now getting lightheaded and dizzy. If that happens when you stand up and you're standing there and you get lightheaded and dizzy, you can just sit right back down. And that is one other thing that can help prevent a fall, no matter where you are after surgery, because many of these are due to what we call orthostatic hypotension. But when you have knee replacement surgery, what I always tell my patients is that don't be afraid to use the stairs. Take them one step at a time. Go up with the good, down with the bad, use the railing, and perform this sit, stand, then go technique. Now, talking to your doctor and your therapist is really important because you might have other health conditions that might make it more risky for you to use stairs depending on your progress with physical therapy and your strength and other medical conditions. So you always want to talk to your doctor and therapist to find out when it's safe for you. But for the vast majority of my patients, when they go home from surgery, they're basically cleared to use the stairs slowly, and it helps aid in their recovery. So I really hope that this has helped answer some of the questions or maybe calm some of the fears that you might be having if you're thinking about knee replacement. And if you haven't already checked out some of my other videos that will cover even more information about knee replacement surgery. Thanks again for watching. I'm Adam Rosen, and until next time, stay safe.